My name is Carla Jackson, and I will be covering the use of therapeutic massage. The definition of a therapeutic massage is the intentional use of touch as a therapeutic modality, otherwise known as therapeutic massage. It is designed to use touch to achieve targeted therapeutic outcomes. Massage is typically provided to improve blood flow or blood and lymph fluid with the intention of reducing tension or flaccidity of muscles, stimulating or sedating the nervous system, and enhancing tissue healing. The history of therapeutic massage dates back to the first massage given in at least the 1800 BC. Early forms of massage originated in China, Japan, and India, and were usually part of a holistic approach to health, including exercise, diet, and the use of medical herbs. Many forms of massage used today, including shiatsu and Thai massage, are very similar forms of massage used thousands of years ago. Henrik Ling was not trained in medicine, but applied his ideas and techniques to the treatment of disease and developed the Swedish massage, the basis of many modern forms of massage therapy. Soon after the success of Ling, the Dutch physician Johann Metzger successfully introduced massage to the medical community. Massage was widely used as a medical intervention until the 1940s when pharmaceuticals became the predominant treatment. Massage therapy is currently one of the fastest growing sectors of complementary and alternative medical therapy. To cover the theoretical foundations of therapeutic massage, we'll start with the gait theory, which is a theory proposed by Malzak and Wall of 1965. Basically, they're explaining the influences of pain perception and how pain is basically distributed through the body, and it's through nerve cells carrying pain stimuli, which are actually shorter than those carrying signals of pressure. So with that theory that pain is carried with a shorter stimuli than pressure, the theory is that when you apply pressure, it actually will stop the nerve signals from sending the pain, and that's why massage can actually stop pain. Foundation that is being covered in the text is stress reduction, and it basically says whether emotional, mental, or physical stress, it affects the autonomic nervous system, which controls all involuntary activities of the body, such as digestion, heart rate, and hormone levels. Two aspects of the autonomic nervous system are the sympathetic nervous system that prepares the body for action, and the parasympathetic nervous system, which prepares the body for inaction. So the response to stress is commonly called the fight or flight, and this is when your body is activating the sympathetic nervous system. And when your body goes into fight or flight, your muscles get tense, and there's releases of hormones from the adrenal gland, which might make your heart start beating faster. But unlike stress, massage activates the parasympathetic nervous system, and which triggers relaxation. Theoretical foundation of therapeutic massage is the hormonal influence on pain perception, and this one is basically just saying that your hormone levels, especially endorphins, also influence the perception of pain. So there's neurotransmitters and chemical receptors which sends out pain, basically pain messengers into your body, and massage kind of counteracts those neurotransmitters because a massage will release the endorphins, which endorphins helps to handle pain. So your endorphin levels go up when you receive a massage, which is actually counteracting a pain message. Right now, I will be covering 3 different disabilities which benefits from the use of therapeutic massage. The first disability I will be covering is arthritis, which there are two different forms of arthritis. There is rheumatoid arthritis, which is inflammation of the joints. It's a disorder. And then there is the more common osteoarthritis, which is the wearing down of the joints. And that's the most common because most people in older age do end up getting some form of osteoarthritis. Now, arthritis is characterized with major symptoms including pain, stiffness, which all typically worsens with age. There was studies done on both rheumatoid arthritis and osteoarthritis in the text. As far as the one done on rheumatoid arthritis, there was a trial done with a group which was trying to determine whether a moderate pressure massage was more effective than light pressure massage when treating rheumatoid arthritis. So this particular study had 27 women with the average age of 51 years old, and they did determine that the moderate pressure massage was more effective in relieving pain, as well as they got more grip strength because these particular women in this study had upper limb rheumatoid arthritis, so they had problems more so in arms and wrists, hands, and so the moderate pressure massage was more effective. Now, also there was another study done on juvenile rheumatoid arthritis in which they split those children in groups of two, which one group would receive the massages for 15 minutes a day done by their parents. The other group got 15 minutes of relaxation therapy. And of course, the massage therapy was more effective in relieving pain and also anxiety. And then that just goes back to the gate theory of pain, which basically tells why the pressure of massage relieves pain. So the massage was more effective. Also, there was a study covered in the text on osteoarthritis. There was multiple studies done, and it did also chart that when relieving pain for osteoarthritis, massage was very effective. Cancer is another disability which is massage is very effective for. Definitely want to cover this because people with cancer have so many different symptoms related to their illnesses. And according to the text, it says that people with advanced cancer typically encounter chronic pain, fatigue, anxiety, and decreased quality of life as a result of the illness and associated treatments. Consequently, a sample of research examining the effects of massage therapy on people experiencing such debilitating illnesses and associated treating was covered. And so Mitchison and colleagues did a study in 2014 which examined the effects of 20 to 30 minute massage therapy sessions consisting of effleurage with limited trigger points, typically using light to moderate pressure, depending on health, on 153 individuals receiving palliative care. And just to cover, the effleurage is the slow gliding touch. That's a technique of a massage where a lot of times most massages do begin with effleurage. Well, at least Swedish massages do, and that's the slow gliding touches, which actually helps to clear the lymphatic tissues as well as stimulate the muscles, warms the muscles, and it gets the blood moving to the heart. And so according to this particular study, it says there were statistically significant improvements on symptoms in short-term association with pain, anxiety, perceived relaxation, and inner peace as measured by the survey adapted from the well-being scale. The last disability that I would like to cover would be the positive effects of therapeutic massage on HIV and AIDS patients. I felt like this was a very significant part of the research because not only did it determine that anxiety was less from therapeutic massage in AIDS and HIV patients, but it also showed that immune function was better as well. And based on Diego and Field in 2001, they compared the effects of a 12-week intervention in which they did a study on 24 HIV positive females. Average age was 17 years old. And this was in comparison to getting therapeutic massages treatment versus a relaxation group. And it did show that the therapeutic massage was more effective in treating HIV and AIDS, and that was based on the blood test done, which showed that there was increased lymphocytes and killer cells after just 12 weeks of massages, 2 times a week. These young ladies were given 20-minute massages, and so this was very effective and compared to the relaxation group, and their anxiety was less, and that was based on a survey given to them during the first and last week of the study. And I think there was a correlation with the stress theory for massages, in which the stress theory basically showed that during stress you're going to your sympathetic, basically your fight or flight mode is on. So all these chemicals are being released in your body, which makes your muscles tense, and it causes all these other negative effects when you are in fight or flight. And it said, based on the stress theory, massages put people, it opens up your parasympathetic, which stops the effect of stress. And so this would just be in relation to why your immune system function is better when you get in massages, because it's basically stopping the possible stress. Okay, so as far as using the therapeutic massage for cancer treatment, there's some things that I have in mind when dealing with someone who may be in pain. We're not going to focus on a deep tissue massage. So the techniques that I'm going to be going over is the effleurage, the petrissage, and Tapo-Timmins. Those are the massage techniques. Now, as far as the effleurage technique, now that is actually a Swedish word, and it's just slow guiding movements like this. It's slow and gliding movements. Now, the person who I'm giving a massage to can actually have on a shirt or no shirt. But if I was dealing with someone with cancer, it probably would be better to do with clothes on. But if there was no clothes being used in the massage, then a towel would be put over this area of the body. Now, for the effleurage, one of the things that is very good is that you can actually be putting on oil with the effleurage, because this movement is a slow gliding technique. You can actually be using this to put the oil on. It's a very soft, slow gliding touch, and what you're doing is you're stimulating the blood flow to the heart. So you're pulling the blood flow to the heart, and it's actually also helping with the lymphatic tissues. Okay, so once we finish with the effleurage and basically have warmed up the muscles, we will move to the next technique, which is the petrissage. Now, the petrissage technique is kneading, which would be when you will basically use your thumb and fingers, and you will be kneading into your client. And you can also use the knuckle techniques, which knuckle techniques you can do a rolling, or you can do a gliding of the knuckles. And this would be the petrissage technique, And it's slow and rhythmical kneading, squeezing, and rolling the muscle tissue. Now, being that, keep in mind, we are still working on a client who is suffering possibly with pain. We would not be doing a very deep kneading or squeezing. We'll be doing a gentle kneading and squeezing in this scenario. Is the tapotement, and I believe tapotement is such a great technique for cancer-related illness because it is a cupping. It's a cupping movement, and when you're cupping, that's always collecting and cupping the blood, and it's in like a suctioning movement, and it's release of blood pressure. So this would help with detoxing as well as helping to lower blood pressure, stress, anxiety. The cupping technique is actually used in a lot of sports related massages as well. But I feel this would be a great technique to use in this scenario.